Okay, so gallstones after weight loss surgery. I'm going to go through what causes them, what it feels like, and how you can prevent them from happening, as well as how we treat them as general surgeons. So, to start with, gallstones, they are hard stones that form inside the gallbladder. The gallbladder is on the upper right side of the abdomen. The gallbladder stores bile that's produced by the liver. So they can be made up of cholesterol or other substances that are found in bile, and they can be absolutely tiny, microstones, up to the size of a golf ball. Any kind of rapid weight loss can increase the risk of developing gallstones, particularly if you've got a family history of gallstones, then you're more likely to form them. Anything that causes rapid weight loss, and because surgery is one of the most rapid forms of weight loss, it's often highly successful from that point of view, but gallstones can happen. They can happen in up to 50% of patients who have rapid weight loss. Okay, so what do they feel like? Often people have belly pain, either in the center, around your belly button, on the upper right-hand side. It comes and goes in waves, especially after you eat a large meal or a fatty meal. So sometimes you might have no pain for several years, and then suddenly you get an episode, and then another, and they become more and more frequent. You might have some nausea and vomiting at the same time, feel bloated and uncomfortable. You might have just one episode and it goes away, or you have one episode and then it comes back again and again. Particularly in those cases where you're having repeated attacks, more than one, you are more likely to need your gallbladder out. It's very different to kidney stones. We don't take out just the stones that leave the gallbladder behind. We always have to remove the entire gallbladder. So if we're talking about taking out your gallbladder, what we're talking about is a keyhole procedure called a laparoscopic cholecystectomy, or a lap chole. This is a smaller procedure than the sleeve or bypass you might have had before, but it's still a major procedure. So what happens is we put 4 holes into your belly. One either around your belly button or just to the left of it, and the other 3 on the upper right side. We go in, find the gallbladder and pull it up. We make sure we've got the right duct, the cystic duct, as well as the artery next to it. Often we put a straw down the cystic duct and inject some dye, and that's a dye to make sure there are no stones beyond it, also to make sure we've got the right duct. We'll clip that off, and we'll clip off the artery, take it out within a bag and pull that out through the largest hole, which is usually about 12 millimeters. You'll stay with us overnight, and most people go home the next day. So it is a routine procedure, but it's still a major procedure. And so how do we stop gallstones from forming? It's really hard to do. If you're going to have weight loss surgery, and particularly in those that have successful weight loss surgery, you're more likely to have gallstones. There is a medication with a big name called ursodeoxycholic acid, which can help to decrease the risk of stones, but it's not PBS listed and can be quite expensive. Most of the time, we don't give any medication to prevent it. Following a healthy diet, maintaining a healthy weight, and reducing the cholesterol load is important. So we check blood tests at least at 6 and 12 months after surgery, and every 12 months after that for life. It is important to speak to your doctor if you've got any of these symptoms, and if required, then gallbladder removal may be recommended, and that is done at any stage from several weeks after weight loss surgery to 12 months, 24 months or longer after the time of surgery. If you do require it, a general surgeon is best placed to give you the best information about this going forward.